My name is Peter Slezak. I am a specialist consultant physician with particular interest in heart and blood disorders, though with a more specific interest as a general physician in the total patient and their complaints. In layman's terms, as a general physician, I get to see people referred by practitioners or insurance companies, lawyers, who may have more complex medical problems that need a detailed evaluation, both with detailed history taking, detailed clinical examination, and at times, where necessary, laboratory investigation to reach a diagnostic conclusion, to assist the patient if it's in my area of private practice or in the area of workers' compensation / disability, to assist making final decisions in relation to settlement issues. In that area, more recent involvement, in part due to my background, long-standing involvement with the life insurance industry, is assessing individuals at the request of solicitors in relation to a life expectancy. Well, my enjoyment started particularly as a general physician, where I, right from the outset, had a particular interest in the total patient and not just a very narrow, though it is important to have this in other areas, of a narrow subspecialty. I had a few defining moments early in my postgraduate training in malignant hematology, where I was, to say the least, disgusted with my senior colleague, who was a very eminent, world-renowned hematologist, who just could not deal with the total patient and was just not listening. And I said, I will never do that. I will always listen to the patient and then hone in on their particular problem. So that has been an interest for more than 40 years. In latter times, I became interested once again with my involvement in the life insurance industry as just more an expansion of my interest in general medicine, where the life insurance industry required people with my perceived expertise to advise on, again, more complex medical problems at the time of claim settlement. Well, again, as I mentioned or indicated earlier, in my private consulting practice, I referred patients by medical practitioners with complex medical problems, more diagnostic medical problems, to achieve a diagnosis and assist in management with the general practitioner. In the life insurance area, it has been involvement with assisting with disability assessment, and as I said earlier, life expectancy assessment. So people who have had, again, in the workers' comp or personal injury area, though I don't examine directly for the personal injury, but many people, particularly as they've become older, have background time significant medical issues that can cause difficult decision-making with respect to fitness for employment. And I'm asked to assess the extent or the significance of background health issues in relation to the individual's claim. What I like about it in general is the variation. No two people are the same, so one has to literally be on the money with every individual and not just go into a comfort zone. Oh, this person has heart disease, and ask 10 at times not relevant questions and think you've done the job. So my area of involvement has come from insurance companies acting for the defendant, and also, well, therefore, various solicitors involved in this area of activity have also been a source of referral. Well, my belief is my opinion is my integrity. So what the opinion that I offer at the end of a detailed assessment, I believe to be an honest, intellectually honest and honest opinion, and it will never vary to suit the circumstance. So I believe that my a long-standing experience, detailed assessment provides a very expert opinion for either referrer from the insurance company or referring solicitor. Well, I think following my assessment, which I believe to have been performed comfortably, honestly, with explanation where indicated, will serve their interests in relation to their claim. With my long-standing involvement in the industry, I would hope with my involvement will lead to ongoing referrals from the respective earlier referrers.